Mamma mia, this is a big medicine. Lots of things. It's a major polychrist remedy in the psoric realm. Psoric is a miasm type of thing, or which has to do with skin. So let's get a little light on this book. Graphites. Yesterday was granite. Tomorrow, well, whatever. It doesn't matter. Graphites is black lead. Lead pencils from the finest English drawing pencils. It says a modification of carbon. Trituration in all potencies. Locally as a, now when I say trituration, usually it's the tincture. Yeah, tincture when it's an herb and stuff, and you can do that, but a solid substance like graphite. Got to calm down. It was a lot to get this done. There's a lot of reading here, a lot of everything. So this is going to go over a little bit, but with graphite or granite, like I did yesterday, you have to put it in a mortar and pestle and grind it with sugar, milk sugar, and then, make the homeopathic medicine from there. So the trituration, and locally as a cerate in sore nipples, or a, what do they call that? A paste. What is it? Lord. Salve. As a salve to put on the nipples or any skin stuff. It's great for skin situations. So graphites, like all the carbons, so it's got a lot of carbon in it. This remedy is an anti-psoric of great power. It is a mineral, and like I said, psoric is a lot of skin things in that. It is a mineral carbon in which there is a small percentage of iron. So also related to ferrum. So the carbons, the iron medicines. The first idea is using the substance as a drug is due to S. Weinhold, who was led to it by seeing workmen in a mirror factory. So this is what we observe these things. Use it as a local application or as a salve for tetters or skin stuff from working with glass, I would imagine. Riguri followed him, using it both internally and locally. Graphites, being one of the forms of carbon, is therefore related to carboanimalis and carboveg, and also calcarb, all the carbs. And as it contains a small percentage of iron, it is also related to ferrum, ferrum phos, ferrum metallicum. Graphites causes slight weakness at first, then a weak, relaxed condition. Anemia, which is, the iron in your blood, so that's where where the ferrums would come in also. Chlorosis, which is a green color of the skin. The typical graphites patient is fat, chilly, and costive. What the heck is costive again? I forget. But anyways, they're heavy set people. Lymphatic glands are swollen, like the skin. The mucous membranes are cracked and fissured. So there's a lot of cracking and fissured. Anytime I hear someone say they have cracked in their hands, in their fingers, anywhere in their skin, in their anus, in their nose, wherever it is, those cracks, and they have scanty secretion. So the secretion's coming out of these cracks. So there's some other medicines for cracked skin, and that's cracked in the mucous membranes and things, and in the anus and different areas. But this one has like a, a honey color, where in the cracks, it has a honey colored secretion coming out. Hufeland, another homeopath, relates the cure of a lady 41 by the internal and external use of graphites of an acne rosacea, which had defied all other modes of treatment. Testi classes graphites in pulsatilla group with silica, calcarb, hypersulf, and phosphorus. So that's why I say this is such a polycrest remedy. It's also related to sulfur group and all that. So in that group, you're looking up some symptoms of graphites, of a patient or a person. Graphites, pulsatilla, silica, calcarb, hypersulf, and phosphorus could be considered. It is a remedy for those persons who have a tendency to put on unhealthy fat, or for those who begin to emaciate. So either way, they begin to emaciate or they put on a lot of weight. Suited to persons a heavy tendency, defective animal heat from defective oxygenation. So that's where the coloring comes. They're not getting the oxygen, and no heat. They're always cold indoors or out. Chlorotics, which is a green coloring. Affection of glands, skin, and mucous membranes is a big key, especially at orifices: nose, vagina, penis, anus, ears, any orifice, mouth. Syphilitic and constitutional ulcers. The patient is usually fat, relaxed, chilly, and costive. What the heck is costive again? I forget. They got all these words that you really don't need to know, but costive. Okay, so graphites, which is black lead. No. Costive. I can't be wasting much time because this is going to be definition. Constipated, slow in action, and all that. So, stout, fair complexion with skin disorders. So anybody that's got more fair complexion rather than someone who has a dark complexion. Fat, chilly, and costive. Cancerous, diathesis, and old scars. So old scars, any cuts, any scars anywhere would be have the ability to become cancerous. That's a 3. Fat and chilly and costive is a 3. Erysipelas, which is a skin infection, that's a 3. Thickening and induration of organs of like the ovaries, the organs, the glands, anywhere, the skin. Excoriation, cracks, and fissures. So a lot of the skin peeling, which is excoriation, cracks or fissures in any part of the body. That's a 3. Absorption of scar tissue. So any scars that won't heal, you would right away consider graphites. Eradicates tendency to erysipelas. Oh, I think it's eradicates a tendency to erysipelas. That's what it is. Okay. Better dark, wrapping up, open air, after walking. So it's all better from all that. Better from hot drinks, especially milk. Better from eating and from touch. Is that better or worse? Okay, here it is. Worse, cold drafts, motion, suppressed eruption. So anytime you take care of any skin problems, and I'll read that later, that go away by allopathic means, we'll say. You give a drug and the skin's fine, but it pushes that disease inwards, which is a suppression, and that's the detrimental thing about allopathic medicine. You may palliate and get rid of something surfacely, but it goes inside and causes more problems. And I'll read something about that, I'm pretty sure, later. The causation is grief, any, ignatia, a lot of them are grief remedies, but grief, fear, and overlifting. So overlifting could be arnica, rastox, bryonia, all these things, and graphites is in there. That's why I say graphites is a polycrest remedy of magnitude. It covers a lot of things. Music makes her weep. That's a 3. This is all mine. Sad and fearsome. Miserable, unhappy, indecisive, thinks of nothing but death. So a lot of mind things, very depressed, very, morbid, unhappy, all that stuff, very miserable. Flatulence, a lot of gas with this one. Can't bear tight clothing around waist. So any clothing around the waist, like a belt or anything, that would really bug them. And the belly's distended from the flatulence. Back is numb in the sacrum and down the legs. They can't have a numbness. Feels vertebrae is like like it's broken. So it feels like the vertebrae is broken in half. Spinal pains, pain in small of back with weakness, pain in nape of neck and the shoulders. So a lot of shoulders, spine, was there lower back? Yeah, sacrum, and that numbness down the legs. Chest has constriction, suffocation, so they're not getting the oxygen they need on falling asleep, which causes them to jump out of bed and they got to grab something to move around because they feel like they're not getting their breath. Worse, midnight and beyond. Pain in middle of the chest with cough, scraping and sore. So it's a scraping sore sensation with that cough, and it's in the middle of the chest. Ears, moisture and eruptions, fissures in and behind ears. That's a 3. Worse, noise. They can't take noise. Tinnitus. So there's like a noises in the ear, which is what tinnitus is. Dryness in the ear. That's a 3. So yeah, there's so much to this. I can only fit so much. Eyelids red and swollen. That's a 3. Eczema in the lids that are fissured. So there's a skin infection with or some eczema on there, and they're cracked. The lids are cracked. A lot of cracking with all this. Blephritis, which is inflammation of the lids. Keratitis, which is inflammation of the cornea. And cystic tumors of the eyes. So any cysts that are tumors on the eyes, and they have double vision when they read. The words blend together in that. Pale, bloated, haggard look, and flushed, haggard look, pale, bloated, and haggard look on the face. It's flushed. They always have flushed face. Acne before menses. So when they gonna get their menses, they get the pimples. Any lady going through that, graphites may clear that up and cause you not to have that problem anymore. Lips are cracked. Facial, and that's always cracks everywhere in the body. Facial paralysis with distortion of muscles with difficult speech. So there's paralysis in the face. It looks distorted, and their speech is difficult. I don't know if this could be in a stroke or whatever, but aversion to sex. Oh, this is female. Aversion to sex. Menses are late, scanty, pale, irregular, and painful. Painful swelling of the ovary, especially the left one. Leucorrhea is pale, thin, profuse, excoriating. The skin is being peeled off. In gush, it comes out in gushes with weakness in back, worse before and after menses. So they could even have the leucorrhea, instead of the menses. So this leucorrhea is a major problem. It's pale, thin, profuse, excoriating, and it gushes out. That's a 3. Retroversion of uterus, so the uterus flips. Eczemaceous eruptions on the vulva, so there's that skin stuff on the vulva. Adverse to meat, fish, cooked food, salt, sweets. Sweets nauseate them, so they can't take the sweets, but they're averse to fish, meat, cooked food, salt. I don't know what else they could eat. Hot drinks disagree. This could be, a cause of anorexia and stuff. Hot drinks disagree. That's a 3, except for milk. They like hot milk. Hunger, no appetite. Head, rush of blood with flushed face, burning in vertex, the top of the head. That's a 3. Headache in the morning with nausea during menses. Humid, itching eruptions on hairy scalp with fetid odor. So there's even a moisture, pus or whatever coming out of the scalp, on the scalp, and those eruptions are itchy. Milk crusts, which is basically that same thing. Eczema capitis, which is eczema of the scalp. A lot of scalp eczema. Scabs on the scalp, bald spots. The heart has like electric shocks. Oh, rush of blood with flushed face, burning on vertex. I did all that. Like if the heart feels like there's electric shocks from the heart to the neck, pulsation of the whole body when the heart's beating, palpitations with anxiety and nosebleed. Urine is sour smelling, pain in sacrum or OS and coccyx, The OS is the area between the stomach and the stomach, or the, yeah, anyways, probably the kidney and the, it's an emptying. That's what the OS is, and the coccyx. So there's a pain there in the sacrum, coccyx, and the OS while urinating. So when they're urinating, they get that pain in those three areas. Stricture of urethra, which causes them not to be able to urinate like they should. Burning and cramps in the limbs, burning pressure in the armpits, edema of the legs. So they're that's a 3. They're retaining fluid in the legs. Nails are thick, rough, and they have ingrown nails. That's a 3. And wens, anytime there's nail stuff, you would right away consider graphites. Excoriation of the thighs when walking. That's a 3. The skin's peeling. I don't know if it's from them rubbing because they're heavier. Cracks and fissures in the fingertips, acrid foot sweats. So there's, they have foot sweats anyways for this person. Stiffness and contraction of toes. So there's a lot of contraction and stiffness down there. Horny callocytes on hands with cracks. So there's almost like a wart on there. Nails are deformed, and a lot of the homeopaths will look at the nails and they'll see white spots like this one on your nail. Means you might need some silica. There's so much I put in here and stuff to get through it all. Okay, anyways, sorry. Stiffness and contraction of toes, horny callocytes, cracks in nails. They're deformed. Okay, so let's go to the lungs. Mamma mia, there's a lot. Spasmodic asthma. So it's an asthma that's like has spasms that comes on. Suffocative attacks, wakes them up out of their sleep, and they must eat. If they eat, they feel better with that suffocative. Dry sweat with cough, dry sweat on the face with a cough. Herpetic eruptions on the organs of the male. So herpes, sex debility with increased desire. So they got this desire, but they can't use the thing. Hydrocele, which is a fluid sac, fluid retention in a sac in the gonads. Priapism, which is itching of the organs. Impotence from overuse and indulgence. So from too much sex, they become impotent, can't have babies. Mouth has a rotten odor. Angles are ulcerated. So there's always ulcers on the angles of the lips, the sides. Taste is sour like rotten eggs. Breath smells like urine. Gums swell and bleed. And there's dots of white fur on tongue. Usually it's totally furred with graphites. If you see dots of white fur, you would consider graphites. Scabs and fissures in nostrils. That's a 3. So there's a lot of scabs in the nostrils. That's got to be painful. Eczema of the nose, dryness and loss of smell, sneezing on opening eyes. So from the light in that, stuffed the nose is stuffed, but it has with coryza, which is thick mucus. Painful excoriation in the side of the nose, inside of the nose. Rectum constipation with large, difficult, knotty stools. And they can have chronic diarrhea of brownish liquid with undigested food. It's very offensive, which is a 3, so very smelly. Fissures of the anus, so cracks in the anus basically, and the anus feels like it's prolapsed. Old scars ulcerate on the skin, so those old scars that don't heal, you would want to consider graphites that would remove that. Moist crusts, and these crusts, that's a 3. The scars are a 3 that ulcerate. These moist crusts have a honey colored fluid coming out of them, and it's usually on the bends of the arms, the bends of the legs, different areas, but it can be anywhere. Eruptions, oozing out sticky exudation. So that it's honey colored and it's sticky, this stuff. And that's what's going on with the scalp too. Poison oak, it's good for. Unhealthy skin, every little injury suppurates or pusses, stuff coming out of it. But the skin is very unhealthy, and any injury will keep having that suppuration of fluids. That's a 3. Glutinous fluid, so that's same thing, that fluid coming out of the skins. Wens, which is fingernail stuff. Eczema is dry and rough. So the skin, it's that eczema they have is very dry and rough. That's a 3. Irritable, breaks easily, and exudes gluey substance. Worse in folds of the skin, like the arms, bends of the arms, bends of the legs, and all that. And it's slow to heal. So any of this skin stuff, gluey substance, it's honey colored. It's a lot of times worse in the folds of the skin, and it won't heal. Anything that don't heal on the skin, scars, injuries, and that, you would consider Graphites, breast, induration of breast or hardening, and the ovaries, hardening of the breast and the ovaries. They're swollen, hard, cancer from old scars. So there's that cancerous diathesis, as they call it. Nipples are sore, cracked, and blistered. Let's see. Sensation is in the book. Let's keep going and I'll get sensation out. Excessively tired, sleepless till midnight. So they can't fall asleep until midnight. Wakes unrefreshed. So they're not refreshed in their sleep. And even the sleep has dreams? Confused on waking, dreams about grandparents, elderly, all that kind of dying, mothers. So they're dreaming all this stuff. Pressure in the stomach, sour belching. So that's sounds like heartburn. Burning causing hunger. That's a 3. So there's a burning in the stomach and it causes hunger. Better by eating. And hot drinks, especially milk. So it says worse hot drinks, but the stomach is better from hot drinks, especially milk. Morning sickness. This is good for a lady having morning sickness. There's plenty of medicines for that. This is morning sickness during menses. So this is not so much the pregnancy, but during menses. Constrictive pains in the stomach, that's a 3. And vomits the food. So the food's not only coming out of the stools because it's undigested, but it vomits the food up out of the mouth, and lots of flatulence. So that digestive stuff is causing that gas, and the food isn't being digested right. Temperature offensive sweats on the front of the body, which stains, everything yellow, whether it's the sheets or the, shirts or whatever, stains things yellow. Recurrent periodic fever, could be malaria, flus, whatever. Chill in the evening once, I don't know what that word, chilly in the evening. So anyways, chronic sore throat and hoarseness with once covered. There it is. That chill in the evening, they want to be covered. Yeah. So they, some chills people want to throw off the cover, or yeah. No, they want it covered. Okay, that doesn't make, of course they want covered when they're chilled. Chronic sore throat and hoarseness with skin disorders. So they got the skin stuff going on and it's affecting the throat. Tonsils are enlarged. Vertigo is worse looking up, reading, or sewing. Choking from a goiter, nodulated goiter. Oh, that should be up in the throat anyways. But they have vertigo whenever they're reading, looking up, sewing, doing any kind of intricate work. And this can be good for a goiter, which not with nodules on it. Okay, the sensation. How'd I do? 23. Boy, there's a lot to this. Sensation, where are you? Oh, wait a minute. Oh, granite. That ain't the one I want. I did granite the other day. Let's see. As if skin on forehead was drawn into 4s, as if skin were before ear, as if a skin were before ears. So, as if a hard body as large as an egg were behind the ear, as if a cobweb over the face, as if a lump in the stomach with beating, as of 2 hammers, feels like 2 hammers beating, as if intestines were torn. croaking as of a frog in abdomen. So that sounds like borigami or rumbling. As if everything would be torn to pieces during menstruation. So feels like there's a lot of stuff tearing. Okay, that's that. Man, that's a lot of stuff. I still got a lot more. So I might get done on time. Hard to say. Man, I tell you what, studying this morning, there was just so much to it. And then if you look at my preamble to this, I mean, there's a lot of things that this is good for. So, comments. Hahnemann was quick to perceive that graphites was much more than a mere remedy for skin disorders. Hahnemann's the guy that came up with homeopathy. Like that, other great skin remedies, sulfur, graphites, proved to be a leading anti-psoriatic. You know, and like I said, with what is it? Where the heck was that reading? The there it is. Nope, carboveg. Where was the oh, there it is. Pulsatilla group is also silica, calcarb, hypersulf, and phosphorus, all in that pulsatilla group, along with graphites. Now it's also being um, grouped in with the sulfur group of remedies. Hahnemann's provings, when he did a proving of them, and observation defines its power over skin disorders. The skin, graphites, is rough, hard, and dry. Eczemaceous, which is stuff coming out, I think, and herpetic eruptions predominate. Eruptions on the occiput exuding gluey humor. So there's glue, you know, like a pus that comes out of the scalp from the, you know, any kind of eruptions that kind of glue it and mat the hair together. Eczema of ear, moist eczema around anus, pimples, acne, and wens. Wens is the fingers, some, you know, fingernails. Graffiti's special characteristic is eruption oozing out a thick honey-like fluid. You know, you may have cracks and no honey-like fluid coming out, you would consider other medicines, but with graphites, if there's oozing out a thick honey-like fluid, you would consider graphites. Wherever such eruptions are found, graphites is in all probability the remedy. Clark, a homeopath, cured many cases, notably some occurring on the occiput, the back of the head, and behind the ears. It is no less frequently a remedy for the results of repelled eruptions of the kind. So, repelled means eruptions that have been taken care of, but it would definitely push things inwards. You would want to consider graphites. Nash, homeopath, records such a case. A child had been relieved of the, this is what I'm talking about, of the eczema capatis, which is glue that uh, eczema on the scalp under old school treatment, which was the drugs. And that's why I say you take these drugs, you think, oh, it took care of my situation. Later on down the road, you may have organ problems and stuff, or you may have asthma, or you may have rheumatism, all because you took a drug to take care of your skin stuff. Whereupon enterocolitis, colitis is stomach stuff, set in and became so alarming that it was pronounced tuberculosis of the bowels. So, you know, the skin stuff taken care of allopathically. Now she's got this stomach stuff, and they'd never admit that they did it, but that stomach stuff uh, became so bad they thought it was tuberculosis. Nash, when called in, found the child greatly emaciated, so losing weight. So that's why I say they're heavy people, but when they have a disease, they can emaciate. With little or no appetite, very restless, passing stools of brown fluid. There's another keynote of graphites, mixed with undigested substances, which is food, and of an intolerable fetid odor, smells bad. Graphites 6,000 C. That's a high, quite a high dose. Cured promptly. He probably at that time those homeopaths were given real high dose in one shot of it, and then they would watch and see. Irregularities in distribution of the blood occur. So the blood, you know, that's sort of flush face. or the pallor skin, they get pale, and mucous membranes. So the blood and the mucous membranes are affected. The circulation is at first excited, then follows loss of energy and consequent venous hyperemia. So coldness and bleeding, and the circulation gets excited, but then it goes away. Fainting readily occurs with great anxiety. Motion is impaired and the tissues relaxed, but paralysis is not complete. So they have some paralysis, the motion's impaired, and tissues are relaxed. The marked characteristic of graphites is a rush of blood to head with flushed face. So that's a very big condition. Belladonna has that, a few others. Clark, again, cured two very severe cases of nosebleed in elderly people where this symptom was present. In one case, there has been flushing of head and neck for many months previous to the attack, and flushing preceded and accompanied each occurrence of bleeding. In the other case, the patient said the precursory flush seemed to come up from his toes. He had his nostrils plugged without a veil, so stuffed up. Graphites in a high potency cured promptly in both instances. The graphites condition is not sensitive, and herein it differs from hepar which has extreme sensitiveness. So they're not sensitive in graphites. If you got all these symptoms and you're considering graphites, and hepar has extreme sensitiveness of the affected parts. The tone of the mind is sad. There is very characteristic symptoms in reference to the hearing. So there are a lot of hearing problems, tinnitus. Hardness of hearing, better when riding in a carriage. So they have other noises around, makes that sound in the ear feel better. Gulan, another homeopath, cured two notable cases of cramps in the stomach with improvement of the cramps by eating. So any cramps they eat, you would consider graffiti, and it makes it better. There was also clean tongue. There's a clean tongue with that. That's why I say, and then you could see little spots of fur, white fur maybe. Milk agrees well. They love milk, especially hot milk. In one case, roast meat agreed, but not boiled meat, and still less potatoes. In the morning, there was a fishy taste, disappearing later in the day. Graphites causes suffocative spells which arouse the patient from sleep. He must jump out of bed, worse at midnight. So, and lachesis you would consider with that. Oh, lachesis is worse after sleep. So this can't breathe, and they got to jump out of bed. It would be graphites, and it's worse after midnight. But when they wake up and they can't breathe, and they're throughout their day, you'd consider lachesis. There's a and lachesis doesn't like tight clothing either, so that's same realm. There's a diarrhea of thin, offensive, partly digestive stools, so the food's not digesting. Constipation is more common. It's more constipation. Stools being in lumps, coated with mucus. That's a key of this, and with mucus shreds. What the heck? I got a flea. Too many animals in there. In the female, the breasts are affected. Pain under left breast at menstrual periods. So you have the left ovary that's a lot of times affected, and the left breast. Often waking patient at night. Hysterical melancholia with occipital headache. So the woman gets hysterical and they get a headache in the back. LEUCORRHEA's perfusion gushes. Excoriating, peeling the skin. Scanty menses form a keynote indication. So when the menses aren't coming on very well, it's very scanty. That's a keynote. When found with other complaints as headache, skin infections, etc. So when they have the skin stuff, the headache, and the menses aren't very good, that's a keynote for graphites. Moist itching, excoriating around anus with fissures. The male sexual organs are affected as well as the female. Uncontrollable sexual excitement with violent erections. Priapism, which is itching of those areas. Clark, that homeopath, had frequently seen this condition produce in patients taking graphites. So when they take graphites, overdose on it or whatever, they would see that violent erections and that. For other things, and have frequently relieved priapism with graphites and impotence. So anybody impotent, you might consider graffitis. The senses are abnormally acute. Music causes weeping, cannot tolerate the smell of flowers, weak, exhaustion of whole body, spasms, contractions of muscles, twitching of eyelids. Cataleptic conditions, in other words, they're paralyzed, can't function. Sensitiveness of internal parts, numbness in various parts, drawing, pain in whole body. Bathing after measles causes paralysis of face. That's interesting. I wonder now we have measles running around America. I wonder if they afterwards, if they clear that up, which I don't know if they are able to. Their face would be paralyzed. It'd be interesting to find out if that's happening. Getting feet wet causes delayed menses. So that's, you don't think of getting feet wet as being, there's other medicines that say influenza, they get influenza from feet being wet. Attacks occur during summer and autumn. So the later in the year, any of these attacks, asthma, anything like that, feet wet, all that stuff, you would consider graffitis. Ears feel stuffed at the full moon. That's very interesting. And I'm wondering that moon's full at night and my sleep. I haven't been able to go to sleep. I usually try to get down at 8, relax, by 10 go out. 10 to 2 is your best time to sleep. But I haven't been able to do that. So that moon is like shining right in my window. Of course, I got a patch that I put over my eyes. But bathing after measles, okay. Getting feel, okay. Attacks occur. Ears feel stuffed in the full moon. Suffering parts emaciated. So wherever they're suffering, the parts are emaciated. Overlifting easily and hemorrhages. So any overlifting you consider graffitis, of course, arnica, bryonia, rust tox, a bunch of other ones. When giving graffitis internally in cases of anal eruptions, the external use of an ointment made with a dram of the 3x trituration to an ounce of cetacean ointment is of great service. So you're making a salve out of a homeopathic remedy. You don't even need the substance. You use the homeopathic remedy, make a salve, and it works great. Hirsch and Prague, two homeopaths, has also used graffitis locally in cases of diseases of nails with very good results, whether it's cracks or wens or whatever's going on, the thickening of the nails, all that kind of stuff. You would consider putting it on locally, that salve. Okay, petroleum, which is oil, lachesis, carbo-veg, carbo-animalis, because it's in the carbon realm, causticum, nitric acid, rust tox, in erysipelas, which is skin stuff of left then right. So any of those ones, when it starts on the left and goes to the right, any skin stuff, you would consider those medicines. Graffiti starts on the right, then the left, antimonium carb, what is that? Ritaliana? I forget what that one is. Pione, nitric acid, and silica is also you would consider with graffitis when it's from the right to the left. In priapism or itchiness, citric acid of a male. In disorders of right ovary, palladium you would consider. Ar, ar, Arum metallicum, pulsatilla, lycopodium, stramonium, and aluminum you would consider in the ovary stuff. Here's better in cars. Nitric acid you would consider with graffitis. Obesity, calcarea arsenicosum with that. With the obesity, trichiasis, borax in fat constitutions for the obesity and calcarb, of course. Sulfur has margins of lids reddened. With graffitis, they are pale. So the margin of your eyelids are reddened in sulfur. That's how you differentiate sulfur from graffitis. And they're pale than usual in graffitis. Euphrasia has thick, purulent discharge coming out of wherever. Graffitis has a thin discharge, whether it's the menses, the nose, the eyes, the ears. Graffitis is thick, and euphrasia is thin. That's how you differentiate, and you're always differentiating. You'll have 5, 10 remedies. You have to differentiate and find out which one will work best for that person. Graphites is a chronic of overgrown, so any overgrowth. Pulsatilla, but pulsatilla has worse and graffiti has better from milk. Okay, so when you're considering between pulsatilla and graffiti's better from milk, pulsatilla is worse from it. The associated constipation with mucus covered stools and gastric flatulency should be taken into consideration and differentiated from such remedies as petroleum and lycopodium. So mucus on the stools and a lot of flatulence for graphites, petroleum and lycopodium. Not a, well, you do have it with those two. Antidoted by aconite, arsenicum nux vomica. So like I said, if you took graphites, overdosed on it, got all these symptoms, we wrote them down. Now you would give aconite or arsenicum or nux vomica, and it would antidote it. Now, if you do that, if you take arsenicum iodatum, rus tox, you would take graphites to antidote those. Of course, after you write down the symptoms. In a proving, it follows well calcar, lycopodium, pulsatilla, sepia, and sulfur. It's a complementary to argentite. Follows well in gastric derangements, causticum, hepatis, lycopodium, arsenicum, and tuberculinum. That is a major remedy, buddy. Considering a lot of skin stuff, but much more than skin. And as you know, I've seen, I went through all that. But this last part that I read, the comparisons and the relationships. A lot of times when you're looking at a remedy, and you're saying, "Man, it looks like this remedy, but it's not working." You go to these areas, and it'll tell you all the remedies that would be considered with it for certain symptoms, certain conditions. So yeah, and that's why I say the hardest part is extracting what's going on with this person, asking the right questions. That's where, as a health coach, that always comes in handy. And NLP, neurolinguistic, anyways, NLP, all these things, learning how to ask the right questions. You get the answers you need, and then finding out what is the major symptom here, where is it coming from, all that kind of stuff. Once you do that, that's like the hardest part, is getting people to respond to what you're wondering. A lot of times they want to hide some things because they're embarrassed of it or whatever, or they just don't know what you're looking for. I asked my cousin, "What's it feel like?" And she says, "Well, it hurts." Okay, is it throbbing, pounding, stabbing, stinging? You got to ask all these, know how to ask the questions. Once you do get what's going on with the person, now you go look up in the repertory. You look in the repertory, which has been used for 30 years. I need a new book. the bee lady wants to pay me for, I guess, give me something for helping her. And I'm like, yeah. She said, "Do you need any homeopathic books?" Yes, I do. I need 2 new, the 4th edition of the Materia Medica and the repertory from my mentor, Robin Murphy. That's like almost $100 each, so that's $200. I don't think you want to pay that lady. But I'm not asking her for it. I'm ignoring that comment. I'll get them books. I'm fine using these books. I've been using them for 30 years. Once you get used to something, you get real good at it. So anyways, so now once you get all the symptoms and you know the condition that you're looking for, you go into there under whatever it is, skin. You look under skin, you look under whatever's going on, erysipelas or whatever it is that they have going on, cracks, fissures, things like that. Now you'll have a batch of medicines it'll give you under that condition. And the more you narrow it down to that, if you just go skin, you get tons of medicines. If you narrow it down more, you get less medicines. Now you want the least amount of medicines you have to consider because you've narrowed it down to a certain condition. That's when you start differentiating them. Now, you go to your repertoire, your Materia Medica, which is the book I always read out of every day with you guys. you go to the materia medica, and that has all the medicines. Now you start looking at the medicines and what what their modalities are. In other words, what they're better by, worse by, what's it feel like, sensations, all these things. Now you have to determine between these medicines, which is another difficult situation, which one would be best. If you give a medicine though, and it's not the right one, guess what? Nothing happens. Unlike allopathic medicine, you give a medicine, it could do like my dad, give him Flomax for his kidney. Now he's passing on, bangs his head, and he's on blood thinners. He could have split his head open and bled to death right there. I took that Flomax. I said, he's done taking that. I don't care. I kept asking him, is it the Flomax? Could it be the medicine? What's going on? They wouldn't say. They didn't, so I said, that's it. No more Flomax. He's walking around. He's out. He cleaned up the dog dirt yesterday. His talking's a little better, but not perfect. So I'm keeping on the Bothrops with him for his aphasia, the arnica for the injury to the head, and I'm using an arnica LM, which is anyways. I may have to take that LM and make another, increase it to an LM. I got an LM1. I'll go to an LM2, an LM3, an LM4. That could really change things. But he's getting around now. He's doing all kinds of stuff. He's very understands everything. He just can't express himself, and that's got to be frustrating. So, like I say, those are the two hard things: getting the right symptoms and figuring out where's this coming from, and what is the actual condition I'm going after to go into the repertory with, to find out the medicines I need to consider. And then to go into, narrow it down to 3 medicines would be great, because now, and then to go in and figure out which one of them medicines match more perfectly the condition that person has. The better I match it, it's like a miracle sometimes. Just like my wife with the hernia, gave her lycopodium. That hernia in 2 days was gone. She would have had to go in, get surgery, get probably a screen put in there to keep it from coming out. Lycopodium, a little sugar tablet, has nothing in it. I think it was a 200C, has nothing in it. In a bottle of water, take it for, I think she probably took it for a day or two. How's your hernia? Oh, it's gone. That still amazes me, how the body absorbed that hernia, repaired itself, all because I gave her a little sugar tablet with the energy of lycopodium. When it went in, body rose up, said, what the heck's this? Cleared up them symptoms. So if it isn't the right medicine, though, you give it to them, nothing happens. Okay. No side effects, no nothing. She's fine. The only side effects you'll get is like they do. They like given a 6,000 C of Graphites. You will prove that medicine. You will start getting these symptoms of, oozing out of your forehead, your head, the skin starting having a dandruff and a pus coming out of there. You'll start having cracks and that. You'll start getting these symptoms. You write them down, then you antidote it with one of these other medicines, which was the antidote was aconite, arsenicum, and nux vomica. You antidote it once you write down them symptoms. Now, what it did to a healthy person, it'll cure in a person that has those same symptoms you wrote down. Someone who's sick comes in, they have them same symptoms that a healthy person got from overdosing on it. You give that to the sick person, and the person's body clears up the symptoms. And like I say, you may clear up the symptoms, like they have all these drugs they put on the TV to, clear up your eczema, your this, your that. I guarantee you, you'll have more damage done internally. Your organs, because the body's pushing things out. It heals from the top to the bottom, which is the most vital part of your body, from the inside, which is the most vital, to the outside, to the skin. And when that skin symptom's there, the vital force, the immune system is saying, I got to get this disease out of me, this sickness. So it's pushing it out, whether it's nose symptoms, sinus symptoms, ear symptoms. The vital force is trying to push this nastiness out. You give us allopathic medicine, clears up the skin stuff or the ear stuff or the nose stuff or whatever, and now you have asthma. Now you have rheumatism. Not a good way to treat things. You might have better skin, but if down the road you're going to have problems internally, which is worse. So that person has them internal problems. I give them a homeopathic medicine. They got joint problems, such I give, like, say, Rust Tox. Now all of a sudden they got skin problems. You know, you can usually you can keep it going with the Rust Tox, but sometimes it may be you may have to switch. You know, you see the symptoms, you see the thing, you ask some questions. It may be graphites now. You give graphites, pushes, clears up that skin stuff. Now they're good to go. They don't have either the joint problems or the asthma or the skin stuff. They're cleared. Now you can go back through their history, uh, say the skin stuff, then back to, like, whatever they had, like asthma as a child, or you go back to because if they had asthma as a child, now they have skin stuff. The asthma's cleared up because they got rid of the skin stuff. You allopathically get rid of the skin stuff. Now it goes back to the asthma. So you may clear up the skin stuff. Now you're looking, oh, they got asthma. You clear up the asthma, then you go back, they had an injury, the knee. Oh, now that knee pain will come back. And I don't know why. Did you ever have that before? Yeah, oh, yeah, years ago I had knee pain. So you go in and you take care of the knee pain. Then you go back to whatever, an injury earlier, measles. They had measles or something. Just you clear things up, inside, top to bottom, inside out, and from the most recent sickness, injury, grief. Even Greece will put on a sickness. It can become physical. A mental, emotional thing can become physical. So you take that back from the history. It'll go, you'll go back through their history, clearing up things until they're healed. And then now you're down to the constitution, whatever the constitution you are. There's a calcarb constitution would be with graphites. They're always just a heavy set person. That's their constitution. They might be a calcarb in that sense. They might go back to a sulfur if they had skin stuff with the graffiti. So, all right, I'm way over, but that's fine. This is a major remedy. I wanted to get it into my community. And as usual, you can age, but you don't have to get old. Depends on what you eat, how you move, and your stress levels. So be kind to yourself so that you